So one of the major causes of airway obstruction in the pediatric population is choking, and it's very important to address this emergency because it can have a subsequent risk of respiratory arrest and death. So as such, you need to be able to identify the signs of choking and be able to act quickly with regards to it. So signs of choking include a sudden onset of respiratory distress, coughing, gagging, and stridor. So there may actually be a history of the child playing with or eating small objects, and also a lack of signs of other illnesses. Remember, it's quite sudden onset. So what we need to assess is whether the child has an effective cough or an ineffective cough. But first, let us go through the choking algorithm. So with any emergency or any situation where you have not sure what happened prior, you want to assess the situation for hazards and check whether it's safe to approach. And then, if unresponsive, you want to proceed to BLS. So if they are responsive, you want to assess the cough. So if the cough is ineffective, you'll do a different pathway to if the cough is effective. So with an ineffective cough, it's not really clear. You have to know whether the patient is unconscious or conscious. So if they're unconscious, then open the airway, give 5 rescue breaths, and commence CPR. If the patient is conscious, you give 5 back blows, 5 thrusts, and there'll be chest thrusts for infants, abdominal for those over 1 year old. And then with an effective cough, you want to encourage the cough and monitor for deterioration to an ineffective cough, because of course you want to follow the algorithm for ineffective cough if it becomes ineffective. So for infants less than 1 year, you want to have the infant or the baby prone, head down across your lap or across your arm, like this. But let's put them across the lap actually. With your head, with the infant's head supported with your thumb at one angle of the jaw and fingers at the other, taking care not to compress the soft tissues beneath the jaw. So you want to deliver 5 back blows with the heel of your hand between the scapulae. 2, 3, 4, 5. Obviously, if the object clears, then you will stop doing the process. Then, with chest thrust, you turn the infant head down, supine, lying supported along your arm supported along your arm with your hand supporting the occiput, and deliver up to 5 chest thrusts. So you're going to use 2 fingers. 1, 2, 3, 4, 5. And you're going to deliver this to the lower sternum, a finger's breadth above the xiphisternum. Okay. So again, just to clarify, your back blows, the infant is lying across your lap. And with your chest thrust, the infant is lying on your arm. So for children over 1 year old, you do back blows with the child's head down, ideally over your lap, supported in a forward leaning position. Deliver 5 back blows, again with the heel of your hand. 1, 2, 3, 4, 5. And then for chest thrust, you stand or kneel behind the child with your arms beneath their arms and encircling their torso. Make a fist with one hand and place the umbilicus and place between the umbilicus and the xiphostomer, and grab with the other and pull sharply inwards and upwards up to 5 times. Take care to avoid the xiphoid process of the ribs. So it's going to look something like this, although it's hard with this model, but you're pulling upwards, 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 inwards and upwards. And again, you repeat the process. So it's important to reassess after completing the 5 back blows, then 5 thrusts. If the child is still conscious, but the object remains, repeat the cycle of back blows and thrusts. If the child becomes unconscious, proceed to BLS when opening the airway. Proceed to BLS. So when opening the airway, if an obvious object is visible, a single finger sweep may be performed to attempt to remove it. However, if the object is further back, just leave it, because you could make matters worse. The reason why you try not to give a back thrust when there is an effective cough is because in the moment when they're coughing and taking a deep breath in and coughing, you don't want them to swallow the object when you dislodge it with a back thrust when they take the deep breath in. So if their cough is effective enough for them to clear the object, then encourage them to cough. But if it becomes ineffective, proceed with the back thrust and the back thrust and the chest compressions. Did I get that? Back blows and the chest thrust or the abdominal thrust.